All right, we're back with our next SCCM update, Pearl. So what's up, you guys? It's your ER pharmacist, Lil Pharma. We're digging into the SCCM guidelines and picking out medication-related updates. Recommendation that if the transport time is over 60 minutes, they suggest antimicrobial therapy in ambulance or in flight. This is a very interesting recommendation from a stewardship standpoint, just because sepsis is a very complex diagnosis, which we know, and it's unclear whether, it's not always super clear what the source is, what the patient's history is, especially in that initial time frame of pre-hospital. And I also have no idea if they can even get any sort of blood culture or anything like that, because we would want to ideally get blood cultures prior to giving antibiotics so we could eventually narrow therapy. But I think that from a stewardship standpoint, this is really interesting because, first of all, I imagine that EMS is not going to be carrying every single antibiotic that we have in the hospital, so they don't have as many options as we do. And I think that that is obviously going to limit it, because we're going to be giving the same antibiotic to every sepsis patient, whether it's appropriate or not. That makes me think we would probably give them very broad spectrum antibiotics. So that's my first qualm, is giving very broad spectrum antibiotics to every patient. And the next thing is that if they get to the hospital and we do a workup, we determine that they actually are at risk for some other type of pathogen. Maybe it's an MDR or anaerobic antifungal. We may have to switch their antibiotics completely. And then we've given them this antibiotic exposure that is completely unnecessary. So just kind of an interesting addition. I do understand that in theory, this leads to quicker antibiotic timing, but I kind of agree that this is maybe a more complex situation that we shouldn't necessarily do for all patients. I know that it's just if your transport time is going to be over 60 minutes, but I personally work in a pretty rural area, so that happens often. So I'm curious what your guys' thoughts are on that. I don't know how I feel about it. I think that I would prefer to wait until I got to the hospital, but if it decreases mortality to give within 1 hour, then it might be worth giving one dose of broad spectrum antibiotics. That's what I got for you guys. Come back for more SCCM updates.